we're talking about maternal health, the children that are going to come into the world, who the work we do will help to support them as they grow and mature in this country. So I'm very, very happy to bring on Dr. Eboni January, who's a board certified OBGYN, who's passionate about improving health disparities, women's health, preventative medicine, and youth success. Dr. January, thank you so much for being with us today.
Thank you for having me. It is
Yeah, I'm sorry, I cut you off.
I said it's a pleasure. Thank you for having me.
Oh, good. No, it's our pleasure. And I know we're not talking politics, but we certainly do want to create. You're here to try to make sure that we can bring women can have safe deliveries and we can safely bring babies into the world while we're trying to figure out how we can make sure that the world they come into is one that they can live and thrive in. But anyway, let's talk about this Empowered Motherhood Tour that you're hosting in a couple of weeks,
Hmm.
and tell us a little bit about that and why you're doing this.
Right. So, I'm a board certified OBGYN licensed in 15 states, including the DMV, originally from St. Louis, but the DMV is definitely home to me. I've been there numerous times. I'm there very often. I speak for a mirror group on culturally competent care, but my plight right now is a maternal health crisis, and not just advocacy, but more so empowerment through education. A lot of women lack education. A lot of significant others and family members lack education and the thing that they need the most, which is health literacy. And oftentimes it's a matter of breaking down the barrier between patients and doctors so that we can make informed decisions as patients. And so that's what the Empowered Motherhood Book Tour is about. My latest book, it's a resource guide for patients, their significant others, the people who love them, so that they can get the most out of their doctor's visits and out of their pregnancy. Because many times these things that are causing maternal casualties are preventable. So I want to make sure that we're able to advocate as women for ourselves, and also significant others are able to advocate for their significant others and women during childbirth. And so that's what this tour is about. It's about my latest book, and it is a resource guide, easy enough for patients to read, but you have to make sure that you're educated enough to understand what the doctor is actually saying to you. So that's what this book is about. And it's for family members also to be informed in the delivery room.
So let me ask you this question, Dr. January, and that is, some women have planned pregnancies, right? They're working on it. Their couple, their significant other, they're working on it, and some not necessarily. But in either case, because maternal health and some of the issues impact all women, regardless of right. More so Black women, but regardless of maybe education or whatever, if there are things that happen negatively, all women are usually impacted, some more so than others. But my question is, regardless of what would be the first three questions you would ask, if there are questions that you would tell a pregnant woman to ask their physician, that may not become a part of the conversation. They should not leave without making sure that they know what.
So some of the things that people never ask is, what are my risk factors? So first of all, we have to be empowered across the board. So if I'm at risk for preeclampsia, gestational diabetes, postpartum hemorrhage, shoulder dystocia, meaning the baby's shoulder getting stuck, what are my risk factors? And so that means that I have to have a conversation with my doctor to say, this is my history, and based off of my history, these are, as a doctor, I can tell you what the risk factors are. So women need to ask what their risk factors are for complications, whether it's pregnancy complications or labor complications. That's the most important questions. What are my risk factors? And based off of those risk factors, what should I expect? Number one question to ask, because a lot of times patients will hold information back from the doctor, and we need to know those things in order for us to best serve you so that we can prep you for the pregnancy process. prep you for the labor process and what to expect. And based off of those, what I'm at risk for, that helps to drive the conversation. So if I am at risk for preeclampsia or postpartum hemorrhage, what should I expect from that? Because sure, pregnancy is pregnancy, but not all pregnancies can be the same based off of the history of a patient, if they're on medications prior to, if they have various comorbidities that could affect their pregnancy. Are they of a healthy weight? Or are they someone who is pretty athletic or exercises? All of these things play a role. So the first question is, what are my risk factors? And from there, that helps to drive the question, the conversation, so that people can ask different questions so that they can set themselves up for success.
And unlike you, because not only are you serving the community, but you've also written a book. So, clearly you're an information provider when it comes to maternal health. What would you advise an expectant mother or father who
Mhm.
actually, may attend some of the, because I assume, some walk in together,
Mhm.
and they find a doctor who's just not communicating. How do you get past that?
You,
You want to ask those questions that you're talking about, but they're not communicating with you.
if they are not communicating, you have options. You can always go to another doctor, right? We live in the day and age of telehealth, concierge medicine. You can get online. There are many doctors, there are many of us who are online that are able to answer your questions. Obviously, from a medical legal standpoint, we can't give you flat out advice, but we can absolutely point you in the right direction. When you go to my social media page, I'm constantly educating. I tell people, DM me if you have something, a topic that you want to talk about or you want to know more about. Absolutely, send me a message. You have options, telehealth options, social media options, where obviously you don't want to get information from just anyone, but a credible source for sure. And you have people like doulas and midwives who, maybe have a little bit more leeway with regards to time to talk to you about various things. But it's okay to switch doctors. It's okay, to seek the help of someone via telehealth as well. But you want to make sure that it is a credible resource, and that will help to drive the conversation. But ultimately, a lot of doctors may be rushed, right, to where they can't answer questions. But if you are coming into a doctor's visit informed, then that basically you start to meet the doctors in the middle, where I'm not explaining something from elementary grade level, I'm explaining it from a middle school level. And so now we can have an informed conversation and an intelligent conversation, to where I don't feel as though I have to sit down and take 30 minutes to explain something. When you go and seek information, then you come to the doctor's visit empowered, and therefore we can have a conversation that is informed, and the doctor doesn't feel rushed. You don't feel unheard. So it's also important for, as patients, for us to do the work as well, because I'm not just a doctor, right? I'm a patient first. And so that's why I oftentimes identify with my patients, because I want to know information and I don't want to feel rushed, but at the same time, I'm going to invest in knowledge as well.
Of all the fields of medicine you could have gone into, why did you pick or select maternal OBGYN to become an obstetrician and gynecologist? What was it about this field to focus on maternal health?
Mhm. A few reasons, actually. My grandmother, my dad's mom, had 14 children.
Okay.
Um, and I watched her body deteriorate, just from, just poor health, poor eating. And at the same time, as I watched her body change, this body who had given life to 14 individuals, I also watched my stepmother as her body changed to give life to my youngest sister. The combination of those two at the same time, it really affected me, and it showed me that the body of the woman is so amazing. And not just that, when I start to study a little bit more and gain information about being an OBGYN, I realized that it was one of those fields where I can be a primary care doctor and manage primary care conditions. I can be a surgeon, not just C-sections, but where we're doing hysterectomies and things of that nature. We can do procedures that are in the office. So it's so fulfilling and so rewarding, because there's so many things that we do. We do primary care, we do surgery, we do small procedures, and we help to bring life. So it was the variety really that affected me, but also watching a body who had given life to so many individuals, to watch it deteriorate, but also to watch my stepmother's body change as she gave life to my youngest sister.
And you brought up something that is concerning also, and that is when you talked about C-sections or deliveries. You know, there's so many options out there, and I don't know if your book gets into this.
Yes.
But, you know, doctors will tell you what kind of delivery you're going to have, as opposed to I assume that sometimes I think this happens, as opposed to saying, you know, asking you, you know, what is your choice? And so talk a little bit about that. I mean, if someone says you have to, we have to give you a C-section in order for you to deliver this baby, a- and that wasn't what you wanted to do.
Sure, sure. So absolutely, my book goes into that. My book goes into prenatal care, pregnancy, postpartum care, mental wellness, the different delivery options, the types of C-sections that are available. But ultimately, I can't speak for every doctor, obviously, but we go through a process. Everyone, for the most part, is eligible for a vaginal delivery unless there's some type of fetal issue that, you know, where we need to expedite delivery. If there is some type of women's health issue where there maybe her anatomy doesn't set her up for a vaginal birth, but ultimately we don't just say you're having a C-section. It is a team effort. Right now, if we get into labor and the baby's heart rate doesn't look good and we need to expedite delivery, then that's one of those situations where we're saying, look, it is time for a C-section. You are at risk for numerous things, maybe bad outcomes with regards to, you know, the baby, bad outcomes with regards to you, and so we need to move forward with the C-section. So I don't know many doctors that are just flat out say you need to have a C-section, or you know, or you need to have a vaginal delivery. I'm not doing a C-section, because you do have patients who want a C-section. They don't
Right.
want to experience vaginal birth. They want a C-section. And so there are people who are at risk for various complications if they were to have a vaginal delivery. And so we talk to them, we go through their risk stratifications, and then we say, okay, I think that this is the best option for you. Talk it over, come back, and we'll make that decision. But many doctors don't just say you're going for a C-section unless it is an emergency situation to where we have to move forward with the C-section. And so we encounter that on a routine basis. I just encountered it last week where I had to do an emergency C-section on someone because her baby's heart rate didn't look good at all, and I needed to move extremely fast. And this is one of those situations where we need the people in the delivery room, the support person, whether it's a significant other, grandmother, or whatever, to deliver that information to the mom, because sometimes it goes in one ear and out the other. But that support system, the person that's not going through the actual process, is thinking a little bit more straight to where, you know, they can translate for us. And this is where doulas, you know, where the benefit
I
of
was going to
doulas,
ask you about that.
this is where and I am pro doula, I'm pro midwife. So I want that
Okay.
to be clear. And so we need an extra set of eyes and ears so that we can deliver our message a little bit more effectively.
I was gonna. You had me laughing when you talk about the significant others, because my father happened to show up in the delivery room with my first son, and he kept telling me to push when the doctors were telling me not to, and I'm like, I can't. Yes, you can. Yes, you can. So I don't know if you've had to put people out of the delivery
We
room.
have. Absolutely. Absolutely. We have some people who've been a little bit overbearing. We want your help, but sometimes it's a bit much. And so that's where, like I said, you have to, if you are someone, a support person that is going to be in the delivery room, it's okay for you to come to the prenatal visit so that we can prep you and prime you for what
Right.
this will be like, to say, okay, when it's an emergent situation, sometimes we're going to have to move you out of the way, and just allow us to take control, because there are things that we know. And when we're in the moment, it's hard to explain. When it's go time, it is go time. And sometimes it's not the time for us to have to explain things. And so this is where you continue to foster a relationship through the prenatal process, so that when we get to it's game time, you kind of understand, you know, what's going on. And so that's where the information is key, because you're just not going into the labor room blindly. Sometimes we don't want you to push. If the baby's shoulder is getting stuck, we don't want you to push, because
Right.
it keeps lodging the baby's shoulder behind the pubic bone. So we may want you to stop pushing, you know. But these are things that, through my courses and my classes and my master classes, where I'm teaching people about this process, about complications, and what questions to ask and how to behave during certain scenarios.
Well, that's fantastic. I mean, what I like is that it sounds as though your book is very thorough
Mhm.
and is a great guide for folks. How can people access it?
It's available on Amazon, Empowered Motherhood. You can also go to my website, drej.com. That's doctor spelled out. You can go to my social media page, Dr.Eboni January. That's doctor spelled out. That's Ebony with an I. A link to purchase my book is there as well. And you can join me in DC for the first stop of my book tour on April 13th at the Busboy and Poets on in Anacostia. Really excited. DC is the first stop. New York is the second stop. So, follow along and, meet me wherever because I'll be
Well,
in a lot of different cities.
we didn't talk about health disparities, and we're kind of out of time, but you're coming to, and I'm sure a community where we have a lot of but we've got a brand new hospital coming
I
actually a couple days, I think, before the tour. And so that's good news, and we
yeah,
finally, women finally in ward 7 and 8 will be able to deliver babies in the ward, which they haven't been able to do
I'll
in a
be
few years. You'll be there.
I'll be there. I'll be there at the grand opening and maybe you'll see me in the labor room. We don't know.
We'll keep our fingers crossed.
Yeah.
Wonderful. Well, congratulations to you, and thank you so very much for producing this book, for being here, for giving an opportunity for people to come and talk to you.
Mhm.
And we're going to help to spread the word to make sure. I'm not sure what Stacy Brown just put in the chat, and I wanted to share that with. Just did a story about how medical schools are losing Black students. Stacy Brown, who's our national reporter, was talking about. Who writes a lot, but he just posted an article that he did on what's happening with Black medical students. So it's really, really important that you are here, and that you are an example too for others who want to go into this field.
Yes, yes, and if students, if you're interested in going into the medical field, they can reach out to me. I do a lot of mentorship. I'm really excited about that. We definitely need culturally competent care and also, more doctors and support staff that look like us.
Wonderful. Well, Dr. January, thank you so much very much. We're going to put the book up one more time, and also the information that you'll be at Busboys and Poets. Give us that date again.
April 13th,
April
it's
13th.
4 p.m. to 8 p.m. at Busboy and Poets in Anacostia.
Right, on Martin Luther King Avenue, right down the street.
Yeah, yeah.
All right. Thanks so much for being with us, and we appreciate you.
Thank you.
All righty. Take care.
Bye-bye.
Where do you